Chronic otitis media is perhaps the most important topic in otolaryngology or ENT, whether it is MBBS exam, MS-ENT exam, DNB exam or even MRCS exam. Depending upon the exam, the threshold for acceptability of wrong answers is different, but the questions generally remain more or less the same. In this video, I am going to discuss some commonly asked questions regarding chronic otitis media, and these are the questions you should definitely prepare the answers for before your exam, irrespective of which exam it is. As long as it is an ENT exam, you have to know chronic otitis media inside out. So without further ado, let's start with the questions. I will only be telling you the questions in this video, but if you want me to answer them also, then make sure that this video has at least 100 likes. I hope I am not asking for too much. Question 1. Define chronic otitis media. Question 2. What is middle ear cleft? Question 3. Name some mastoid air cells. Question 4. How do you clinically differentiate between mucosal type of chronic otitis media from squamosal type of chronic otitis media? Question 5. How do you clinically differentiate active stage of chronic otitis media from inactive stage of chronic otitis media? Question 6. What are the different types of hearing loss possible in a patient with chronic otitis media? Question 7. Briefly describe the physiology of hearing. Question 8. How can you clinically understand the different types of hearing loss as well as the degree of hearing loss? Question 9. What are the complications of chronic otitis media? Question 10. Briefly tell me the nerve supply of pinna. Question 11. What are the different landmarks that are visible on a normal lateral surface of the pinna? Question 12. What are the dimensions, directions, parts and nerve supply of external auditory canal? Question 13. What are the different dimensions, directions, openings and function of the eustachian tube? Question 14. Tell me the otoscopic findings in your case. Question 15. Why is chronic otitis media no longer called chronic suppurative otitis media? Why is COM not known as CSOM any longer? Question 16. What are the different parts of tympanic membrane, including the layers of tympanic membrane? Question 17. What are the different types of perforations possible in the tympanic membrane? Question 18. What are the different ossicles? Mention their parts. Question 19. What are the different parts of middle ear? Question 20. Tell me the different structures seen on the different walls of the middle ear. Question 21. Tell me the different parts of a cochlea, including the number of turns it has. Question 22. Tell me the different fluids present in the different parts of the organ of Cotti's. Question 23. Tell me the different frequencies that correspond to different parts of the cochlea. Question 24. Tell me why hearing can be normal in mucosal type of chronic otitis media. Question 25. Tell me why hearing can be normal in squamosal type of chronic otitis media. Question 26. How will you proceed with management in this case? Question 27. What are the different types of tympanoplasty? Question 28. What are the different types of mastoidectomy? Question 29. What are the advantages and disadvantages of canal wall up mastoidectomy? Question 30. What are the different advantages and disadvantages of canal wall down mastoidectomy? Question 31. What are the indications of cortical mastoidectomy? Question 32. What are the indications of radical mastoidectomy? Question 33. What are the different types of ossiculoplasty? What is the classification of ossiculoplasty? Question 34. What is masked mastoiditis? Question 35. What is coalescent mastoiditis? Question 36. Name the different mastoid abscesses along with their locations. Question 37. Why is there foul smell from the ear discharge in a patient with chronic otitis media squamosal type? Question 38. How is the mechanism of development of complications different in acute otitis media from chronic otitis media? Question 39. Mention the different enzymes responsible for bone erosion in squamosal type of chronic otitis media. Question 40. What are the different preform pathways that are responsible for spread of disease in chronic otitis media? Question 41. Define cholesteatoma. Question 42. What are the different hypotheses that have been postulated regarding the development of cholesteatoma? Question 43. What is the most widely accepted hypothesis regarding the development of cholesteatoma? Question 44. What are the different types of cholesteatoma? Question 45. What is the clinical criteria for diagnosing congenital cholesteatoma? Question 46. In which decade of life is congenital cholesteatoma usually diagnosed? Question 47. What are the different hidden areas in a mastoid cavity that need to be explored to ensure complete removal of cholesteatoma during mastoid surgery? Question 48. What are the different potential complications of tympanoplasty? Question 49. What are the different potential complications of mastoidectomy? Question 50. Mention the boundaries and clinical importance of Prusac space. Question 51. How are the oval window and round window covered? Question 52. Tell me the intratemporal course and branches of facial nerve. Question 53. Tell me the clinical tests of hearing and the clinical tests of balance. Question 54. What is Donaldson's line and tell me the clinical importance of Donaldson's line. Question 55. What is grade Negau's triad and in which disease is it encountered? Question 56. What are the different parts of the vestibular apparatus and mention their functions?